Breaking the Wall of Tissue Monitoring. Nithin Sadeesh, Falling Walls Lab, Eastern Finland.
Good afternoon, everyone. I'm pretty sure everyone here enjoys simple activities like taking a walk, a run, or for those who are more adventurous, even a trek. But for 600 million people, these simple activities are often accompanied by pain, and that's because of osteoarthritis, a silent condition that basically destroys your articular cartilage between your joints, which then leads to progressive pain, immobility, and a growing socioeconomic burden. Currently, close to $100 billion are spent every single year in order to treat osteoarthritis. Yet, there's no form of treatment that helps in the long-term restoration of the joints. But over the last decade or so, tissue engineering has emerged as a promising alternative where you combine the principles of biology and engineering to develop an artificial cartilage, which is then surgically implanted into the patient suffering from osteoarthritis. But despite the large potential, currently, the quality of the engineered tissue is unknown. And this is because there's no protocols which help for the real-time monitoring. The current approaches are basically destructive, time-consuming, and are basically based on trial and error. So people might be wondering, why is this quite an important wall to break? It's quite simple, because out of the 600 million people, 300 million people require implant-based surgeries. And by implementing a simple quality control approach in terms of tissue engineering, we can use tissue engineering as a form of treatment in order to treat osteoarthritis. And that's where our solution comes in. We combine the principles of near-infrared light and machine learning together to what we call as NIR Sense, which helps in the real-time and non-destructive monitoring of the engineered cartilage. So how does NIR Sense work? It's quite simple. It uses light, specifically in the near-infrared range, to detect the chemical changes not only in the tissue you're growing, but also in the surrounding media, as well as the scaffold that helps in the growth process. By detecting the chemical changes across all of these platforms, the researchers and clinicians will be able to develop and regulate the growth protocols and also personalize it specific to the patient suffering from osteoarthritis. Our main aim with NIR Sense is quite simple. We want to remove the trial and error process in terms of tissue engineering and make it more data-driven and precise. NIR Sense was something we conceptualized in 2022. Since then, we have published our research finding in various peer-reviewed journals, making us one of the first people to implement NIR in terms of tissue monitoring. And we are currently in the process of, we have also got our invention disclosure, taking us one step closer to prototype development as well, and which will in turn take us one step closer to clinical translation as well. Finally, I would like to say that with NIR Sense, we are very confident that we can break the wall of tissue monitoring, and it will light the way to better tissue engineering decision so that people suffering from osteoarthritis can enjoy the simple joys of life again. Thank you.